Chordoma of the Clivus and the Diagnostic Role of Imaging, a Case Report by Dr. Halim Abdul, Taylor Cardwell, and Dr. Giancarlo Paletti. The clivus is a groove that slopes upward from the most anterior edge of the foramen magnum of the occipital bone. Chordomas are rare tumors derived from notochordal remnants. The clivus is the second most common site for these tumors, and they can develop anywhere along the craniospinal axis. Due to their rarity, these tumors can be a bit difficult to diagnose. CT scans and MRIs play a large role in diagnosing them, so much so that both imaging modalities are required to make the diagnosis. In this case, we had a 52-year-old HIV-positive male presenting to the emergency department with a one-day history of right leg numbness and difficulty walking. The patient also had signs and symptoms of pneumonia. In order to rule out stroke, CT scans were obtained which revealed the presence of a rather large mass originating at the clivus. Due to the mass's expansion into the ethmoidal air cell complex, an ENT surgeon attempted to biopsy the mass via nasal endoscopy but was unsuccessful. MRI images were then obtained and the suspicions of clival chordoma were confirmed. Unfortunately, this patient was not stable enough secondary to his pneumonia for the surgical intervention these tumors typically require. Therefore, we focused on the diagnostic value of imaging in this case report. You will focus your attention on the center column. We have the non-contrast cranial CT on top. On CT, these tumors typically appear as a lytic, well-demarcated soft tissue mass that is locally destructive. In image 1A, the arrows are pointing to the calcifications scattered throughout the tumor. These calcifications are often thought to be remnants of previously healthy bone that the tumor has broken down rather than novel calcifications. Image 1B has arrows pointing to what appear to be septations within the tumor, but again, this is likely fragments of bone that have been destroyed. Image 1D shows how the tumor has invaded the ethmoidal air cell complex and highlights why biopsy was attempted via nasal endoscopy. And while the biopsy was unsuccessful, the surgeon did note fullness in the sphenoethmoidal region. Below, we have the MRI images. MRI images are superior than CT for depicting the true extent of the tumor as well as how it interfaces with the neural structures. Both images 2C and 2D have arrows highlighting how close the tumor is to the left optic nerve. Without intervention, it is likely that the tumor will compress the left optic nerve and compromise its function. Image 2B also highlights how the tumor closely interfaces with the cavernous sinus segments of the internal carotids. These images are important for differentiating between other tumors that can be found in these regions. These tumors include chondrosarcomas, pituitary macroadenomas, osteosarcomas, and hemangiomas. Imaging also plays a role in the planning of surgical approach to remove these tumors. Imaging allows for surgeons to visualize how the tumor interfaces with the vasculature and neural structures within the area in order to avoid them and avoid further damaging these structures during removal of the tumor. These tumors do require surgical removal. And again, unfortunately, this patient was not clinically stable enough during the course of his hospital stay for surgical removal. Thank you.